no harm to be grateful. And we at the National Council of Negro Women are exceedingly grateful to be joined this afternoon by sisters and brothers in the struggle with us. I'm Johnnetta Betsch Cole, and I have the honor of serving as the president and the chair of the board of the National Council of Negro Women, NCNW, as our organization is known. We were founded 85 years ago by the legendary educator and activist, Dr. Mary McLeod Bethune. And when she founded NCNW, she said, this will be an organization of organizations. Now, of course, NCNW is and always will be associated with Dr. Dorothy Irene Height, an iconic champion of civil rights and women's rights, who led our organization for 49 years. Today, NCNW's membership is over 2 million women of African descent. And we're organized as 32 national women's organizations that are called affiliates. How special to see 2 sister presidents, and perhaps there are more of our affiliate organizations. And NCNW has 300 community and campus-based sections. Well, you can tell by my description of our origin that we believe in partnership. In fact, partnering with other organizations is in NCNW's DNA. We're always saying to each other that we believe in yet another African proverb that says, if you want to go fast, go alone. If you want to go far, go together. Today, we are exceedingly pleased to formally announce a partnership with Vaccinate Your Family. This will help our communities, the communities that NCNW serves. It will help us to serve our communities better. And today we are formally announcing our gratitude for the phenomenal support that we are receiving from CDC. What is it we're going to do with all of these folk rowing together, moving in the same direction, arms linked? Well, I better not use that metaphor yet. Socially distant, but together. Well, we are going to take on a very important task. And that is, we are going to, in partnership with others, we are going to, 1, acknowledge the reasons for vaccine hesitancy in our communities. 2, we're going to provide vaccination education. And 3, and ever so importantly, we're going to increase vaccination opportunities. Now, let me add that today is a special day for yet another reason. And that is that we are in cahoots, not only with NCNW affiliate organizations, we're in cahoots not only with Vaccinate Your Family, but we are now in cahoots with women's immunization networks, known as Good Health Wins. We are very proud to be in association with, collaboration with, the National Hispanic Christian Leadership Council. And now let me say, what really, really tickles my heart is that we also are in collaboration with the WNBA, the Women's National Basketball Association. So as a result of this extraordinary collaborative effort, there should be, over time, and let's not make it too much time, there should be a reduction in the health disparities that haunt Black, Latina women, and others, of course, who we touch. There should be a reduction in health disparities. We are again so grateful to the Center for Disease Control for providing the funding that will allow this mighty coalition of women's organizations to do good work. A closing proverb: when sleeping women awake, mountains move. My sisters, we got some mountains to move.
Wow. Wow, that was just so amazing and so inspiring. I want to start by thanking Dr. Cole for her encouragement and support of this project. I also want to thank Paulette Norvell Lewis, Constance Newman, Dr. Tamara Wiles Lawson, and the entire board of directors for their valuable input and expertise. Of course, we'd like to see everyone safe from COVID-19. Several family members contracted the disease, from a strapping college athlete to a young nephew with a wife and toddler daughter to an 80-plus-year-old sister-in-law with notable comorbidities. The same is true of many of our NCNW colleagues and members. For us, this is a personal quest. One of the first persons to become ill with COVID-19 was a beloved member of our environmental team. Fortunately, he and my family members made a recovery. We shuttered our building on Pennsylvania Avenue, invested in upgraded safety and sanitation and measures, thanks to our talented Chief Operating Officer, Crystal Ramser, who has provided essential expertise in every phase of this effort, from staffing to budgeting and beyond. NCNW's planned activities advance the CDC National Stakeholder Strategy for achieving health equity. We all know that the socioeconomic reasons, the socio-determinants of health, make African Americans and Hispanic populations less likely to be vaccinated and more likely to suffer serious health consequences from vaccine preventable diseases. What exactly is Good Health Wins? Dr. Cole has already said it is a collaboration led by NCNW to raise awareness of vaccines as a critical element of good health. It is a network of activists in states and local communities committed to reaching out to those who may need help, getting an appointment, and engaging with immunization coalitions to help them understand the roots of hesitancy and barriers to access. This is an issue across the lifespan. It is research, education, and public relations to craft messages that resonate and make sense to our members and their families and friends. It is a strategic answer to inaccurate information found on the internet And it is a challenge to the healthcare industry to do more to actually achieve health equity. What will Good Health Wins produce? Surveys, toolkits, messages, Zoom calls, small group meetings, direct mail, text messaging, whatever it takes, contact tracing, outdoor ads, expert briefings. Hesitancy is not the only barrier. We take the position that you can't lecture or scold. We must convince with good information and be respectful. Dr. Cole has already expressed our gratitude to the Centers for Disease Control as we help to develop and work with these credible, reliable voices already in the neighborhoods. The concept for Good Health Wins came to us from the brilliant mind of strategist Synovia Moss, who is a consultant, member of the Wisconsin Vaccination Network, and who years ago, under the tutelage of Dr. Haidt, helped to organize Black family reunion events. COVID-19 has uncovered the depth and breadth of health disparity in a dramatic and irrefutable way. I watch the faithful sanitation workers who show up every Thursday morning, seemingly oblivious to the obvious danger to which they are subjected each and every day. This project is personal. We are highly indebted to our experienced Director of Philanthropy, Rosalind Hannibal Booker, for her knowledge and dedication. And I want to thank Maggie Holmes, CEO of the Wright Group Grant Consultancy, for her federal grant-making expertise and attention to detail. We expect to involve all 2 million members in all 32 national affiliates, beginning with the Links Continental Societies, Women's Home and Overseas Mission of the AME Zion Church, Women's Missionary Society of the AME Church, National Black Nurses Association, National Black Coalition of 100 Women, and Zeta Phi Beta Sorority Incorporated. Shara Denton is on the call. She is a very able young woman who is both president of Georgia NCNW and chair of the National Health Equity Committee, which is in formation. She represents our state leaders as well as our executive committee. She is a health educator by profession who owns her own PR firm based in Valdosta. Our 10 targeted states were chosen because of vaccination rates and proximity to large numbers of people of color. Georgia, Texas, Florida, North Carolina, South Carolina, Maryland, DC, Virginia, New York, and New Jersey will be the first round of states. We want to thank you for coming today and encourage you to attend our 85th anniversary celebration on February 26th. Now, we talked about zeal, but zeal and passion are not enough. For that, we need expertise. And we turn to Vaccinate Your Family, one of the nation's foremost nonprofit organizations, working to increase immunization. And now I want you to hear from Ms. Amy Pisani, who is Executive Director of Vaccinate Your Family. We are so grateful for the partnership with Vaccinate Your Family, including the extraordinary Erica DeWall. Amy.
Janice, thank you so much. They tell you should smile on Zoom. I cannot stop smiling. I'm in the best mood today. I told Erica this morning, I feel like it's such a happy day for the entire Vaccinate Your Family team. We've been, thrilled to be partnering with the National Council for Negro Women. And I know, we've been working together with your team, with you and Synovia and Rosalind and all the folks there for months now. And it just, for today to be the day that it becomes a reality, it's such great news. I think not just for Vaccinate Your Family, but for your networks, because coming together, we just have so much power and we're really going to save lives. So what a great day. So Vaccinate Your Family's founders, they're former First Lady Rosalind Carter and former First Lady of Arkansas, Betty Bumpers, two of my favorite women in the world. They are my role model. They are the power behind Vaccinate Your Family. And they believed in the power of women's networks. They really, truly knew that together we could be an unstoppable force for good. We don't have to tell you about the devastating impacts of COVID on underserved communities. You talked about your families, and that's really what it's all about, right? It's the people that we're losing. We have to put a stop to it. And there's been a lot of discussion about reaching trusted messengers to tell these same communities about the importance of vaccines. And, but the problem with this approach is that it's still an attempt to tell people what to do. And we and our partners with NCNW, we believe that if you share good, accurate immunization information with people, they'll make the right choice for themselves and their families. And so Good Health Wins is therefore, it's not a program that's meant to only deal with the current COVID-19 pandemic. That's where we're going to start, but it's not where we will end. Each community has its own unique blend of hesitancy and access issues. And the Good Health Wins program will help us uncover what those barriers are and help us to address them in a way that makes sense to the community that we are working with. We're also going to take these learnings from those communities and our advocates to our partners throughout the nation and to the health policy tables and decision makers. If we do not want to see a repeat of what happened this past year with the COVID epidemic, this tragedy, then we must make lasting changes to the way that communities are able to access vaccines and overall medical care. Vaccinate Your Family focused our efforts for 3 decades on resolving childhood vaccine access issues and eliminating disparities. And we are committed to solving adult vaccine access issues in the coming decade, right along with our partners at NCNW. So our entire staff and our board of directors are incredibly excited about this wonderful partnership. I want to thank Janice and Dr. Cole and all of the folks that we've been working with so far. And I'm looking forward to meeting the folks in all of the states. We want to thank you for allowing Vaccinate Your Family to be a part of this critical life-saving program. And before I give it back to you, Janice, I have to say to Terri.Jackson for the WNBA that I am a UConn Husky mom. And as you know, the UConn Husky women are the most amazing women in basketball. So I'm extra thrilled. I feel like I'm around a star today. So thank you for having me, and thanks for being part of Vaccinate Your Family.
Thank you, Amy. Thank you so much, not just for today, of course, but for all the weeks and the meetings and the calls. Thank you so much. Been a great partner. I'm excited too. Just a few days ago, Dr. Cole introduced our team at NCNW to Terri.Jackson, who is our guest today from the Women's National Basketball Players Association. We are so grateful for their prompt response, and you will hear from them today about why they think this cause might be worthwhile. These highly educated professionals have agreed to lend their influence and voices, not just to Good Health Wins, but the good efforts all across the country. We owe them a debt of gratitude. Terri.
Thank you, Janice. And I just love the energy that Amy brought to all of this. Good day, everyone. I am Terri Carmichael Jackson. I get to have the privilege of serving as the executive director of the Women's National Basketball Players Association. That's the union that represents WNBA players. Where do I begin? First and foremost, Dr. Johnnetta Cole is a force. She is an advocate and a staunch supporter for the women of the W. To hear that NCNW, under Dr. Cole's leadership, is working to provide our communities the real deal information about COVID-19 vaccines, and then to be invited by Dr. Cole to join this effort is just a tremendous opportunity. It's tremendous for the players to continue to connect the dots in a meaningful way, from their voting rights work to mobilizing around public policy initiatives. At the Players Association, we have committed to scheduling a series of educational Zooms for our members, the WNBA players, so that they can learn more about COVID and the vaccines from nationally recognized experts in medicine and public health. I am thrilled that the players are taking this public health initiative as the next item on their social advocacy agenda. My president, Nneka Ogwumike, has said on behalf of the players that this is an extension of their work in the movement for Black lives. So here's our plan. Step 1, the players will be informed and armed with the information that they need to make the best decisions for themselves and the best decisions for their families. Step 2, many will be positioned from there to be strong, learned voices for Black and Brown communities, for women who we know many times are the primary decision makers in their households, and to be those good, strong, learned voices for underserved communities. Again, this is a tremendous opportunity to join forces with NCNW and its network. We know that preparation is the key, so we have committed to doing the work. We get to start with elevating the campaigns like Good Health Wins, and we know there will be others. It is a pleasure to be a part of this day and this initiative. Thank you so much.
Thank you so much. And your enthusiasm is also palpable. And it's a great feeling that we have. Thank you. We can't wait to get started. Black communities are suffering, but so are others, including the Latinx community. We are pleased and proud that the National Hispanic Christian Leadership Conference has agreed to partner with NCNW to provide Spanish translation and distribution of materials. Dr. Gus Reyes is here today, I believe, to speak on behalf of NHCLC.
Thank you so much for that wonderful introduction. And I want you to know that the National Hispanic Christian Leadership Conference is thrilled for this partnership. And we're hoping this is the beginning of many more partnerships with you as we go forward in the future. I've invited Reverend Girien Salazar, who's the Executive Vice President for the National Hispanic Christian Leadership Conference, to join me. You see him with a headset on his head there in the picture on the screen. But I did want you to know that before I turn the mic over to him for just a quick word, we speak to the gatekeepers representing about 42,000 Hispanic evangelical churches in the United States. So just imagine that a lot of the people that are out there in our communities don't understand English, and they need to have this information in Spanish so they can take advantage of the opportunities. So linking with you and helping to develop this bridge of partnership, it's just so new. It's historical, and we're excited about being able to impact preschoolers and those who are having to go to school and get ready for school. That's a big deal for us. And so I just want to say thank you for the opportunity. I represent the executive committee, and I'm just thrilled for this partnership. Thank you to Synovia Moss and so many of you who've helped put this together with your giftedness and talent. And we're going to do something significant together. And I just want Reverend Salazar to say one quick word, and then we'll move out of the way.
No, thank you, Gus.
Well, let me unmute myself. Thank you so very much, Dr. Reyes and NCNW. Thank you so much for allowing the NHCLC to partner with you all. As Dr. Reyes just mentioned, the NHCLC is wholly committed to improving the life and quality of life of Hispanic evangelicals and Christians and Latinos, people in the Latino community in general. And there are two problems that often are facing us, is either that we're either misinformed or uninformed. And that can be because of language barriers. That can be because maybe we're absent from some of the conversations that are happening. And we don't see our faith and science as something that work against each other, but they work in tandem. And so we need to get good information to our people, to our constituents, so that they can have and live the best life that they're meant to live. And we're so happy to partner with you all, with the Black community, African American community, because some of the challenges that we face, you face, and some of the challenges that you face, we face. And so we know that this is for a specific time and for a specific moment that we're called to work together in this initiative. And we believe that we can see our young children and families to take charge of their health in new ways that maybe they had never imagined before. And we know that through that, we can begin to just really bring what we would say in our language is just bring glory to God. And so we're so happy and happy to partner with you all.
the pleasure is all ours. Thank you so much. We appreciate it. And we're looking forward to our very next steps. I want to remind everyone that the 26th of February, we'll celebrate NCNW's 85th anniversary with a symposium on the philosophy of Mary McLeod Bethune. It should be a lot of fun, and we hope it'll be interesting. The backbone of our effort will be the women and a few right-thinking men who are members of NCNW. NCNW has many stakeholders, as you have heard, board members, executive committee, national committees, local sections, state coalitions, and affiliates. Each of these groups is playing a pivotal role in Good Health Wins. Representing NCNW affiliates, please welcome Dr. Kimberly Jeffries Leonard, president of the Links Incorporated.
Thank you so much, Janice, and good afternoon.
Good afternoon.
You know, COVID-19 truly is personal, and none of us have not been touched by COVID-19. So that's why I'm so pleased to join with you today and to be a part of this very important initiative and partner with the legendary National Council of Negro Women, led by the legendary Dr. Johnnetta B. Cole, and these amazing partners as a part of this initiative. The Links Incorporated has been a longtime advocate for improving the health of African ancestry families and communities. Addressing the significant health disparities that we face isn't just a casual cause for us. We know this work saves lives. Our specific targets of heart health, obesity, mental health, oral health, and access to affordable health care really do make a difference. With the onset of this COVID-19 pandemic, our efforts have been intensified and are even more critical. This virus has exposed and exploited our health-related vulnerabilities. We must keep working to reverse this trend. We support and are proud to be a part of Women's Immunization Networks, or WINS. We know that vaccinations which prevent disease are important not only for individuals who take them, but for their families and communities where communicable diseases can spread and kill. The Links Incorporated, more than 16,000 members, are working to increase knowledge about fighting COVID and discussing the importance of vaccines. We know that sharing information, encouraging discussion, and being open and honest will help ease concerns that many in our communities have and are understandably skeptical about. So the Links Incorporated are proud to join our voices to those who are working to raise awareness, dispel myths, and save lives through increasing participation in timely immunizations, especially right now with the COVID-19 vaccines, which protect women and families through vaccine preventable diseases. We know from experience that is much more than a slogan. Good health really does win. Thank you for allowing us to be a part of this impactful partnership.
Thank you, Dr. Kimberly Jeffries Leonard, president of Links Incorporated. We're so grateful to you, the Links, and to all of our stakeholders, affiliates, Dr. Thelma Daly, who chairs the affiliates committee. Each one of you has played a very important and necessary role in getting us to this day. And the future is challenging, but we are up to the challenge. As Black women and women in general have proven over time, we've got work to do. Dr. Martin Luther King said, all men are caught in an inescapable network of mutuality tied in a single garment of destiny. Whatever affects one directly affects all indirectly. The pandemic has certainly demonstrated that. But Dr. Bethune said decades ago, and it remains true, our children must never lose their zeal for building a better world. They must not be discouraged from aspiring toward greatness. Well, we are her children, so we can't lose our zeal for a better world or be discouraged. We have to keep on climbing. As somebody would say, onward. Are there any questions? Mr. Johannes?
At this point, ma'am, we do not have any questions. Are there any members online of the press? If you would like to ask your question, please raise your hand and we will unmute you.
Brother Jay, can you see me and hear me?
Yes, ma'am, I can hear you and we can see you now.
It would mean a great deal to me if we could have just a word from the sister president of Zeta Phi Beta sorority.
Absolutely.
Thank you so much, Dr. Cole. I just want to say that Zeta Phi Beta Sorority Incorporated is so proud to be able to partner with such an extraordinary team of individuals that have come together, because we must remain unified in the fight, in the struggle. You see, we've been struggling for so long, and now this pandemic has shown so much to so many, but we've already known that these things have occurred before and have been going on for many, many years. So I am truly proud to say that Zeta Phi Beta Sorority Incorporated, and I must say a special shout out to Rosalind Hannibal Booker, who is on your team that has helped to put this together. We in Zeta are proud of her. We are there for you, and we will do whatever it takes to make sure that we amplify our over 150,000 voices so that our people of color, will be able to receive the health care that they need so that they can get over this situation. Thank you so very much. I appreciate you giving me this opportunity this afternoon.
And we so appreciate your being here.
You know, Sister E.D., the old professor in me sort of stirs at a moment like this. So I think Sister Zenobia, who has so much to do with all of this, she's one of the main stirrers of this pot. I think she should at least give us a few words.
Well, good afternoon, everyone. I am truly in the afterglow of just wonderful women and organizations coming together to do the work to address the disparities in our community. And there's no other organization like NCNW, its affiliates, its members, its partners, its ability to convene other organizations and to bring everyone to the table. We are so blessed. But now the real work begins, and I'm excited to be a part of it. Thank you to everyone for being on this fabulous team, for your leadership. Dr. Cole, to Janice, Erica, Amy, Rosalind, Crystal, everybody for that yeoman's job. And a special thank you to the CDC as well for believing in this idea, and our other organizations and companies that are going to come to the table, because it'll take a lot to get this done. But we're ready to do the work. And so we're so blessed, and thank you all for being a part of this.
At this point, we will conclude our news conference. Thank you very much for attending. You can watch our news conference on ncnw.org. It would also be on our Facebook page and on our YouTube channel.
Thanks, everyone.
Thank you.
Thank you.
Thank you all. It was excellent. Everybody did a great job. I'm so very excited for us to be a part of this. So this is fantastic. So thank you.
See you all tomorrow, probably.